and welcome to another episode of Your Stories. Today we have a great interview with a lovely lady called Erika, and this is quite an interesting perspective in this story because Erika has had many years of different symptoms and come through a lot of those hurdles, but it's a really interesting approach because she is now a part of the medical model. So she's a physician's assistant, and so there's quite an interesting perspective in terms of how she's dealt with the mind body medicine angle and how she's managed to kind of understand that given her training and stuff in the kind of medicine world. So I thought this was a really interesting one to do. And yeah, I'll stop spieling and just let her in and she can tell you the story. This is Erika Hoffman. Let's see. Hey, Erika.
Hello, how are you
Hi,
doing?
welcome. Thank you for taking the time to come and do this with me. I really appreciate it.
Yeah, thank you for the opportunity to kind of share my story and hopefully inspire some other people
Yeah, for
as well.
sure. For
Yeah.
sure. So I just did a little bit of an intro into just some really vague basics about, you've had a long suffering story and how you're now managing to kind of, almost retrain your brain in terms of what you've been taught in school and now what you've understood from mind body medicine. So I think it's a really interesting story to share from that perspective, but we'll get to that, I guess, a little bit later on in your today situation. So if
Yeah.
you want to just maybe start, whenever these your symptoms started, what sort of age you were, how long they lasted, that kind of thing, just kind of bring us up to speed on the start of your story, and we can just take it from there.
Sounds good. Yeah, I mean, I'm pretty new in my journey. I just kind of realized what TMS is, mind body medicine more than anything, really since September. So it's this
Wow.
year,
Okay.
September. So only a couple of months,
That's
which
cool.
I think that's probably why I fast forwarded so much because I've gone through so much in my past. It all just clicked, made sense.
Right.
So growing up, like as a kid, I was always someone who had like big emotions, like hard to control emotions, lots of energy.
Right.
And I remember now thinking back how I had issues growing up. So I had a lot of insomnia. I remember like checking the clock all the time during the night,
Really.
counting the little digital, 80s clocks that we had.
Yeah.
And then I always had recurrent infections. Actually, I had a lot of strep throat infections, episodes of chest pain that we weren't sure what was going on.
Wow.
The biggest thing, though, I think was I was a teenager. So about 15, 16 years old is when the lower back pain started. So
Right.
I was in a dance team. We called it POM here in the US, in the Midwest
What's
here.
that?
It's kind of a hybrid, I'd say, of gymnastics with dance. So it's all
Cool.
choreographed moves, but essentially a lot of body work. So it was pretty hard on the body. And we were competitive. We were actually really good at what we were doing in the States. So
Amazing.
yeah, so it was pretty intense and competitive, like I said. So
Right.
I had an injury. I somersaulted and had a significant back pain, swelling. Kind of got home, started to do chiropractic care. That was the first time I started anything. And
Mm-hmm.
it helped at that point and kept going through the POM in my high school years. And then I had a significant injury. I think I was a junior or senior, so about 17.
Yeah.
And that is what really kicked everything into gear. So I had an x ray and they did see a congenital abnormality. So
What was the abnormality?
it's still confusing, even like medical dialogue. Essentially, I have an extra segment in my lower back.
Oh, wow.
And so one of the segments where it meets your pelvis, your L5S1, is not
Yep.
normal. And it's
Same.
fused essentially on one side, and then the
Right.
other side is like an extra joint. So essentially,
Wow.
like that junction doesn't move right. Okay.
Okay.
So I was told at that point, you are not allowed to do this. You're not allowed to do that. You shouldn't do this. All of those things that just all drove in fear of hurting myself further for what I was doing. Um,
Yet
and
you'd
kind of like,
you'd been okay, like okay up to
yeah,
that point, and really physically athletic as well, like
yeah,
not even
yeah,
just like. normal
Yeah, I
grade
was,
athletic,
pretty athletic.
Olympic.
Yeah.
Yeah.
And so, I mean, I was basically telling myself, well, I'm still going to do it at that point. But still with like a little bit of hesitation. So I went through chiropractic care, lots of physical therapy at that point. And I was managing fairly well. So that was like high schoolish. Graduated,
Hmm.
went to a university that was semi close to home, but it was still far away. So it was a
Hmm.
definite transition. And again, back pain significantly created issues at that point. So limitations going to and from class. I remember laying on my, dorm room floor, like laid
Yeah.
out, couldn't move, spasm. Again, physical therapy through that time in my life. And really just kind of continued, on and off, just like, oh, it's just the way I am, chiropractic care just to maintain me. Again, limiting how much I can exercise at that point, thinking, oh, it's just
Yeah.
my back pain. Never did a lot of medicines except just over the counter things at that point. And things ramped up kind of, during PA school. So I'm a physician assistant and I went to a local school in the Midwest here.
Hmm.
And again, now knowing what TMS is, I had a lot more issues during school
Right. You
than
only
just
realize after though, don't you?
spasm.
Like, oh, that
Yeah,
was probably TMS too. And oh,
yeah.
this. Yeah.
I had the back pain, some headaches, a lot of anxiety because it was a very stressful situation. A lot of IBS kind of came up at that
Right.
point. I had palpitations. I had had some previously, intermittently, growing up, but in
That's
PA
really
school,
frightening,
they
isn't it?
ramped up. Yeah.
Yeah.
So I had gone through some testing, like a Holter monitor, things like that, to see what it was.
Yeah.
And it was always kind of negative, or mild this, mild that,
Normal. Yeah. Yeah.
nothing significant, which was reassuring at that point, I guess. Um, so that was during school. Graduated. I started at my first job, which was in orthopedic surgery. I
Oh,
always wanted to
wow.
do orthopedics. So in my job, I was also a first surgical assist. So basically, I assisted the physician in the operating room,
Amazing.
suturing, things like that. So first job out of school, it was pretty intense.
Yeah.
I remember standing for 10, 12 hours a day and my back
Wow.
feeling like it was just going to break in half. Um,
Yeah.
and again, knowing now, I mean, it was just the situation, stress, a lot of different things that brought that
Sure.
on. And also at that point, I developed more foot pain. And interestingly enough, this
Mm.
physician was a foot and ankle specialist. And so he would look at my feet and say, oh my gosh, they're horrible. You're broken. You
Oh,
need to
no.
have surgery when you're older.
Ugh.
You need this, you need that, And so that again, I think
No.
started driving in the fear of something's wrong with me, something
Yeah. I
physically
mean,
wrong.
why wouldn't you believe them, especially given your training and these people are your like your
Yeah,
gurus, right? They're
and I'm
your
seeing
yeah.
it every day. I'm actually in the operating room with
Right.
these structure issues that people are getting fixed, and
Yeah.
so
Why wouldn't you trust that?
yeah. So of course that I think that's what started my foot pain essentially, along with some other things. Um, and then we ended up, I met my husband, soon to be husband. We ended up moving to a different state.
Right.
So it's significant change in our lives, and away from my family. And that is really what I think the turning point of my pain issue started. And again, thinking back how much of a stressful situation,
Yes.
and my body was telling me like, you need help with this. So that was when I started getting leg pain, and like paresthesias in my leg, my feet, kind of
You
all
had
of
what in
that.
your legs? Sorry, what was that?
Oh, sorry, paresthesias, like
Paresthesia. Yeah.
numbness and tingling,
Okay.
um, in my legs, and just
Wow.
significant pain. So where I was working at that point was a pain management facility, and it was on the
Wow.
East Coast.
So
And
what
they,
can I ask you a quick question
yeah,
there? What were they I'm really interested to know, knowing what sort of work you do now and what sort of like knowledge that you had, even going back to when you were having back spasms and lying on the floor and stuff like that. What what sort of diagnosis did they give you other than the fact that you had this issue with your L5S1
yeah. The way I
sacrum or
was
whatever?
told is at that point and growing up in like teenage years was because the segment's not normal, which we love the word normal.
Yeah.
Um, it is your muscles basically are working overtime because
Right,
it's
right.
trying to move better, and then they start shutting
Yeah.
down over time.
Yeah, I've heard that
And
one
so I
for
had to retrain a
myself
lot of
too.
that.
Okay.
In the episode when we moved to kind of the East Coast, where I was working, so it was a physical medicine, rehabilitation, and pain management facility. So it was definitely like a hybrid approach to how you treat patients.
Yeah.
However, since I started there, again, my pain started increasing, got my first MRI, saw those issues, and I had a disc herniation that was significant
Of
at
course you
that
did.
point.
Yeah, of course you did.
Yeah, yeah. So
More
then,
fear, more like tragedy. Oh my God. So many
and
things on top
so,
of each other.
I knew I didn't need surgery. Like I wasn't at that point.
Right.
But I was still doing chiropractic care routinely, physical therapy with new orthotics. That was the first thing. I had another thing with my feet. And then I started having treatments. And so I ended up going through, I can't even remember the count. I had epidural steroid injections, I had facet injections, I had SI joint injections, trigger point injections. Um,
My God.
I think that was it for that. And then there is a technique that I still think that is very helpful.
Right.
Um, and it was regenerative therapies. And so what that is, it's injection technique to inject different solutions to mimic a new injury. And so your body's kind of responding to that new
Right.
injury and trying
To
to heal
heal
itself.
that. Right. So where was that
So,
injected into your?
correct. So prolotherapy has been around for many years. It's actually using a dextrose or sugar solution. And so it's injected into the ligament attachments. And so that triggers them to tighten to therefore, heal this chronic
Yeah.
inflammation state.
Wow.
And then I had that 6 times, I'd say. And then I also had a platelet lysate epidural. So what that is your own platelets spun down, frozen, they
Hmm.
lyse. They're actually injected into the epidural space with a filter, lidocaine, and I think a little antibiotic at that point.
Wow.
That, again, was it more placebo, my mind thinking that this was going to fix
Possibly.
me,
Yeah.
versus maybe it did help, heal the actual damage of the tissues. But regardless, that was what really helped my back pain. So, I mean, that was
Right.
like the stepping stone to improvement.
I mean, in
Um,
theory, though, your back wasn't necessarily damaged, though, right? Although
correct.
it's feeling like it's completely up the wazoo, it's
Yes.
not.
Yeah. No. I mean, now I
So
know that I was never broken.
it's treating a symptom that maybe
Yeah.
it made an effect on, but yeah, it didn't work for very long, right? You're saying that it's.
Correct. I've had kind of up and down since then. And then since then, I've had 2 kids.
Oh wow. How did you
So
get
I've
on
had
during your pregnancy and stuff? Was that
during
hard on your body?
pregnancy,
Did it
actually,
distract you?
yeah, during pregnancy was fairly okay. It was usually the after that, with
That's
everything kind
interesting.
of trying to tighten together. Um, at that point, again, we moved. I had significant, headaches. I was working in emergency medicine at the time, and so there was a lot of stress at that point. I think I had
Yeah,
the,
for
the
sure.
child, my child, so my firstborn, and we weren't near family. My husband actually was not close by when she was first born.
Okay.
So that was hard. It was hard.
Yeah,
So
I
I
bet.
did, have postpartum depression,
Right.
anxiety. I'm not ashamed to say that just because I
No,
think
why would
not
you
said
be?
enough to moms.
Absolutely. Yeah, let's normalize that, please.
Yes,
For
yeah.
sure. Thank you
So
for
at that
sharing that.
point, I was, having a rough time. My back went into spasm. I was crooked. I know Dan, on your recent interview, kind of went over
Yeah,
his
I
episode.
was like that too, just completely
Just
lopsided,
crooked.
either forwards and sideways or
Yeah.
sideways. Yeah, crooked like
So
a.
I had a couple other episodes along those lines. Yeah, so kind of fast track, and then we are, I'm in the Midwest now. I'm in a different job, but I feel like in the last, year, I had increased symptoms. I had significant headaches, tension, like everywhere, basically
Yeah,
whole body tension,
right.
TA issues. I had to get braces and just some other, I'm trying to think of what else that currently, 'cause I
It's
feel
quite
like
an
head to toe,
encyclopedia of things you've had
head to
there.
toe, I could label things of what I was
Yeah,
kind of
for
dealing with.
sure. So did
Um,
you, I
yeah,
mean, do you think that, I think over time, if this stuff isn't obviously addressed, then it does just kind of pile up and get worse and worse and worse with different things and different stuff and different messages coming from your brain probably as well. Like, okay, she's not taking notice of this, let's do this. And then suddenly there's one great big thing that you're like, shit, okay, I really need to take note of this. What's going on? So
yeah.
when did you
the turning point.
Yeah, like how did
Yeah.
you get from this medical model kind of frightened
Um,
phase into now, into, well,
yeah.
into
So
mind
like I
body?
said, I had done a lot of treatments, and then moving forward after my first child, I did more prolotherapy locally where I'm at now. I've been chiropractic care, kind of holding me down. Medications, I had acupuncture at some point.
Yeah,
I honestly have to look at my list of how many things I've tried.
totally
But
understand that. Me too. Everything.
fast forward, I had my second child, who actually is only 9 months, and so I had
Okay.
him during the pandemic. So COVID hit our area, and I was pregnant, so it was very concerning.
Yeah.
Had him during the height of it, and so I had also a postpartum complication, and so I had to have
Okay.
surgery when he was only 10 days old.
Hmm.
And so, following up with all of this, I ended up going into pelvic floor physical therapy. I
Right.
never had pelvic pain per se, which I know it's very common with TMS.
Yeah.
Um, and so I somehow got to a pelvic floor physical therapist in my area, and I will forever be singing her praises. She's
Oh,
amazing. First
really?
of all, I don't know if she wants me to tell her name, but she's great. She's on the community board. I know that. She
Oh,
told
great.
me, she goes, she's like, your pelvic floor is fine. She's like, but tell me more about your back pain. Cause at that point, it was just something I felt was me. It was like part of my identity. Like,
Right. You
I
had your
don't want to
injury.
talk
That
about
is
it
just what it
anymore.
is. Yeah.
It's just what it is. It's who I am. And she said, no, like, you don't have to live in back pain. And I'm like,
Love that.
what do you
Yes.
mean? And so she says, have you ever heard of Dr. Sarno? I'm like, no. And or Nicole Sachs. And I go, no. And so she wrote it down for me, and she goes, and it was kind of, how when you first get introduced to that, you're kind of like, huh?
Yeah. What on
Because
earth
she
is this?
said, well, it's about repressed emotions and how that can really, manifest into pain situations or other medical problems. And I'm like, what are you talking about?
Yeah.
And I'm like, well, I've always been an anxious person, which is part of my list, and well, I'll take a try. I'm kind of at that point, my breaking point, where I think I've tried
Yes.
everything. So I
Desperation
literally got in
hits.
my car. This was like a week before my 36th birthday. So like September. I
Hmm.
got in my car, put the first podcast on, and she said, listen to episode 1. I go, okay.
This is the
And
cure for chronic pain,
Nicole
right?
Sachs, which,
Hmm.
yes, the cure for chronic pain. She's again,
An
I'm so,
angel.
I don't even know how to describe my
Yeah.
gratitude towards her
I
and all she's done
understand.
for people,
Yeah.
including, I know you.
Yeah.
So I listened to the first podcast, and I was just tearing in my car thinking, this is my story. She's telling my
Amazing.
story, even
Amazing.
down to, how she was told at a young age that she was broken, something was wrong.
Yeah. And the
Um,
insomnia she had as a child, same as you, the loads of the story
yep,
must have
and
been
then as a
resonating with.
mom, and just the
Yeah.
stresses of that,
Yeah.
and so it just clicked. It just clicked.
That's
And
amazing
then,
considering your
yeah.
medical mind as well, that how much you
So
resonated with that.
I started to journal speak, which, I think that most of your followers are aware of that, but essentially it's just journaling, your inner
Yep.
emotions. There's no filter.
Yep.
And growing up, I had done that some. I actually now think about that. I write letters to people, but never sent them, things like that,
Awesome.
to get my emotions out, but never put a label to it.
Yeah.
And so I did that. I remember the first day I sat right where I'm at right now. I journaled, and I felt the room was spinning. I had all these just weird sensations running through my body. And then I meditated following. And literally 24 hours, I was about 75% pain free.
What?
Yeah. So
Miracle, child. That's
I know that's not
crazy.
normal. I know that it's not typical. I know Dr. Sarno
Wow.
has, and maybe Nicole had mentioned it being an awakening, and so,
Yes.
but I was about, because I was suffering at that point. I was just low, in a lot of different ways, and just pain. I think I had headache for like a month. It didn't break.
Right.
And so I literally was, yeah, 75, roughly 80% pain free. Um,
That's
and
amazing.
so again, I just kept going. And
Yeah, you must. What did you think at that point, though? Were you just like, this is some sort of miracle, or is this even, am I imagining this? Is this like too good to be true?
yeah,
Like,
exactly. It was kind of more like that also, and it was almost like a high. Like I've never done stuff,
yes.
but it was very like heightened, and
Yeah,
uh,
yeah, the
like
awakening.
hallelujah moment. I don't
Yes.
even know how, like, epiphany, I guess.
Yeah, yeah,
And
yeah.
so, my anxiety was gone. This weird numbness I had had in my shoulder blade was gone. My
Wow.
foot still bothered me, but I mean, it was significant. And the psoas muscle that you have mentioned before in some of your resources,
Hmm.
that's always been tight on me. It was not as tight, all these different things. And then I
Wow.
remember probably a week into it, I was exercising at home here, and my exercise was walking because that's just what I could maintain. And um, I was on the treadmill, and I was like, "Eff it! Like I'm gonna run,"
You can
because I was
swear if you
told.
want.
What was that? Oh,
You can swear if you want. This channel is swearing friendly.
good to know. Uh, yeah, I was listening to some, who knows, 80s hair band. And I was like, you know what? Fuck it. I'm going to run. No one, everyone's always told me I can't run. Why? I can do it. I'm not
Let's try
broken.
it. Yeah.
And I ran, and I did not have pain after.
Oh my God, you must have been absolutely
I,
elated.
yeah, yeah. So, I mean, that was also something that tripped me into believing, being a believer,
Yeah. How could you
belief,
not at that point? I mean, especially doing
universe.
something vigorous like that, like you would
I
expect
mean,
some sort of pain regardless, right? If you're
I
doing it
mean,
that
my
after so long.
stamina is a different story. I
For
I
real.
couldn't go very long because I
Yeah.
felt, that was. But anyway, so
Wow.
that since then, I've been continuing. I've had some things come back. I've had some symptom imperative. Just this morning, my hand was numb, like carpal tunnel syndrome feelings.
Yeah.
Um, different issues. And to backtrack, I don't know if I had mentioned. I ended up when I was 2013 is the year. I ended up having a cardiac surgery, heart surgery, because I was
Okay.
having
Yeah.
some palpitations
Right.
at
Wow.
that point, and I was having dizziness and different things. And the cardiologist basically said, this is where the problem is. I can fix it. So I had surgery for the palpitations. It did
Whoa.
help, but I have noticed them increasing again, kind of since starting the work because it's uncovering different things.
What
So
did they say? Sorry. What did they say
oh,
that was wrong with you that you had operated on then, just in case it resonates with anyone else that has this
correct. Yeah.
diagnosis,
So
whatever?
I know I'm backtracking, but when I was little, like I said, I had a couple,
Yes.
skipped beats is what it essentially felt like.
Yeah. Same.
Different like racing heart, there's different arrhythmias.
Yeah.
And the previous testing, Shanna showed minimal things. When I was, in my 20s um, and early 30s, it was getting worse. And again, I was getting dizzy, kind of almost lightheaded with the sensations. And so what I was told, this is kind of ironic at this point, is your body has a second pacemaker. You are having a fight or flight sensation every single time this happens. And so when the heart
Whoa.
does this, I know now I'm thinking about it. So when your heart does that and this, your body, your central nervous system is telling you that you need to fight, and your adrenaline's going up and then going down. And so therefore, that's
Ah.
going to cause more
It's
symptoms,
like
right?
spikes of yeah, yeah, yeah. That makes total sense.
But now I'm thinking, oh my gosh, that was TMS, because that's what TMS
What
does.
you say? You say the magic F and F word, then it's like, oh my God, what?
So
What?
then, so the reason I went through the surgery is because we wanted to have children. I didn't want to be medication, and it was
Yeah,
causing significant issues during the day. So the diagnosis was PVCs, or preventricular contractions.
right.
Essentially, when a heart kind of skips a beat because there's a second pacemaker that I was born with. Essentially, so they went and burned it. Um, Burned
Whoa,
it. So,
that
anyways, it
sounds
did help.
hectic.
I think I've had some palpitations again with increasing everything lately. So yeah, and that kind of brings you up to where I'm at now. And so now, with this light bulb moment and what I do as a profession, I just, well, a few things. I struggle with the idea of, me knowing different medical, education,
Yeah,
treating patients with chronic back pain, have gone through a lot
yeah,
of different modalities. I was the one that prescribed those things, prescribed medications,
sure.
went through their MRI, was the one that, discussed it with them, did the injections, scheduled the injections, all those different things,
Yeah,
scheduled surgery, saw them after surgery. So I struggle with that, nothing to my fault that I was doing incorrectly,
yeah.
at
You
that
didn't
point.
know that was what you were told. That's what you've been
Uh,
told and educated to do.
so even now, though, I feel like I'm trying to incorporate what I know now personally, kind of towards my professional drive. I've reached out to some of the um, gurus, I guess you'd call them, or
Yeah,
the experts with TMS and stress illness.
the
I have
physicians in the
the
industry.
physicians,
Yeah.
yeah,
Hmm.
One also Nicole Sachs, I've reached out to her as
Mm-hmm.
well, and you as well.
Mm-hmm.
And just to get different feedback, see how I can try to learn more, incorporate different training. There is
Yeah.
an association that for medical physicians and practitioners that I've been trying to follow, um, and Dr. Schubner, I guess,
Yep.
actually, you and Dr. Clark. So this is the book that
Yes.
this is their
Amazing book.
textbook. Yeah, so I'm starting to
Amazing
work
book.
through that.
They do a course as well, don't they? Dr. Clark's
They do.
PPDA, they do a course as well. Is that
They
something
do,
that
and
maybe you can look into?
I've looked into that. Unfortunately, the cost is a situation right now that it's
Sure.
kind of costly, so I haven't really figured that out yet. But I did look into that as an opportunity for education. So we'll see
So,
where
yeah,
it
do you
takes
think
me.
this is, I mean, it's really interesting because I've spoken to only a handful of people for this series so far, but each person has had some kind of interest in using their experience from this. And this is so common. This is exactly what happened to me, exactly what happened to Dan,
Yeah.
Nicole. Is like the experience that you go through with this, it's so amazingly educational and almost miraculous that it's like if you it's just a natural progression for you to bring that into your life and somehow serve others with that.
Yeah.
So especially in a situation where you are, that now you have this sort of increased knowledge and education on this side of things, that you would be able to, if you can weave that into your
Hmm.
kind of medical model job, then that would just, you never know how much that can just like reverberate into the norm, into the day-to-day kind of medicine. I mean, that would be amazing. How does that work then in terms of like, would you need to get a different role, or is that something you can just weave into what you're doing? I don't know how that works.
In my current position, it is limited. I have reached out to the integrative medicine uh, group where I work.
Uh-huh.
They are receptive. There have been a potential opportunity to speak for that physical therapist that I had mentioned. There
Yeah.
is a pain management panel, hopefully going next month. So
Wow, amazing.
just I'm obviously at a starting point where I'm new into this. There's so much to learn.
Yes.
Growing up, ironically, going into what I wanted to do, I always wanted to help people. So that's the interesting thing is with all of my back pain growing up and all of the sports injuries, I wanted to be that person to help others. And so I,
Amazing.
wanted to do physical therapy. I wanted to do, surgery, different things.
Yeah,
And so it is kind of frustrating because I'm like, I wish I would have known about this 20 years ago.
for
Um,
sure.
However, I know that my journey is where I need to be now. So
Yeah.
yeah, I think the biggest thing is, like I said, I took away, I'm not broken. I always was trying to find something to fix me. Something was fixed. I needed
Something
something to
external.
fix.
Yeah, yeah, yeah.
I needed to find this doctor. I needed to do this procedure. I needed to get this brace or this medicine, this
Yep.
supplement, this
Yep.
type of option. And realizing that, you know, I don't, my body is going to be the one that's going to help me through everything. And so I really had to look at myself, look at my past, and kind of be on the other side of that. And another person I want to mention is Sarah Blonden, which I believe you
Yeah.
her. She's
Eh,
literally an angel.
Definitely. She's my favorite
During
too.
that like first 2 weeks of TMS realization, I had always had the insight timer on my phone, kind of didn't look at it a lot. I opened it
Hmm.
up and I go, oh, this looks interesting. And that night I'm like, sold, we're good.
You kind of
Um,
look like her a little bit, actually.
oh, really? Oh,
Yeah.
thanks. Um, but I actually just started reading her book or audiobook for her heart mind, which I think I
Heart
recommend
minded. Yeah, I've
for
got
a
that.
lot of people. It's
Beautiful.
an amazing book, and there's
Hmm.
meditations in the book too. So
Hmm.
um, yeah, so that's kind of brought you up to speed, I guess, with
That
where
is
I'm at now.
insane.
Yeah,
Wow. I mean, so much happened to you, but and to resolve, well, to be so dramatically different in such a short space of time
yeah,
is just amazing. What do you think was, I mean, you said you started journal speak. That was the first modality that you kind of tried, right? Mind,
yeah,
body, wise.
yes, yeah.
So
I
did
mean,
you,
I had done. Sorry, go ahead.
no, go for it, go for it.
I had done, like I said, some acupuncture in regards to like healing. I don't know
More
all the rest
Eastern
of
kind of stuff.
that.
Yeah, yeah.
Yeah. And then I have always done yoga or different exercise forms. I tried meditation before, but never did the guided stuff. So I think that's just me. I need that.
Yeah, me
Um,
too. I can't
those are the
meditate on
biggest
my own.
things that I had tried before.
Yeah.
Yes, but now I do my routine is I do it at night. I feel like that's just the
Okay.
way my brain works. I need
Right.
to get off my chest before I go to sleep.
And you have kids as well, so it's kind of tricky
It's my
to
time. It's mommy's
get
time.
any time. Yeah. You're in
Go
bed, leave me
for it.
alone. Yeah.
I do that, and then the meditation, 10, 15 minutes, just like kind of Nicole recommends.
Hmm.
I have had some relapses, obviously, since starting.
Sure.
My back bothers me. I had a big flare right away, right after. And it can be frustrating, but then you have to really remember that, your body is really trying to uncover, you know,
Yeah.
30 odd years of all these issues. And I know
Exactly.
the
It's
saying,
taken you this long to get there.
a
It's not
third,
gonna
what's the saying? Like Nicole says that takes 20 years or 30 years to get into the woods.
walk
It's
in the
not going to take
forest. Yeah, exactly. It's gonna
not
take
going
you
to
longer
take
to come
2
out.
minutes to get out.
Mm.
So that's just a daily reminder. It's a daily practice, just like
Yeah, it just
brushing.
comes and goes. And I think as well, like it's important to mention that, symptom imperatives may hang around. You might just be the personality type where you have to deal with some anxiety throughout your life, or you have
Yep.
to, just cope with different things. And like Nicole says, sometimes we feel things in our hearts and sometimes we feel things in our bodies, and that's just the way it goes. There's no
Yep.
cure for that. Like that's
No cure
humans.
for, no cure for human pain.
That's
Yeah.
it. So,
So I mean,
um,
one of the struggles I have though still is with what I do is, acute versus chronic pain,
yeah,
and was my pain real? And yes, my pain was real, but what's that real association with Western medical based things and pain, and I think
yeah.
there's still the science to be done with that. I know there's a lot of neuroplasticity situations and brain science
Hmm.
that are happening right now.
Hmm.
um, so I definitely agree with a lot of the physicians where you need to rule out obviously any of the
A
major
million
medical
percent.
problems that are
Absolutely,
going to cause
yes.
issues. And I think Dr. Sarno in his book Healing Back Pain, he had even mentioned that,
Hmm.
let's say you have an injury, you have an initial injury, you sprain your ankle, it's going to hurt, right? Because your body got injured.
Right.
um, but if it's beyond that typical point of what acute pain would be, then you start thinking about why is it still there.
Right.
And I think that's really missing a lot, because that's really what's driving people into that chronic pain
Yeah,
category.
absolutely. And I think a lot of the time it's very common for a lot of people to know, like even for your story, that you had that injury as a gymnast or as
Yeah.
a dancer, and then you will always attribute that as your kind of weak spot.
Yep.
I did gymnastics the same and kind of dance and ballet and stuff growing up. And I remember once doing like a somersault into a crash mat and landing on my head, and
Oh
like my
wow.
whole spine just got
Yeah.
like
Yeah.
concertinaed. And
Ouch.
so when
Yeah.
I found out that I had a herniated disc and my MRI looked really jacked, I was like, oh, well, that's because of when I was 12, I fell on my head, and then, yeah, I think, and Shubhana teaches a lot about this as well, about like, there's a type of pain that is learned pain. So you have that pain or you have that injury in your life and it's learned and those pathways are there and that's just the way
Yep.
it continues. So it's really tricky to kind of switch your mind away from, am I damaged, to I'm not damaged. Your body has the capacity to completely heal itself.
Yep.
And once you're out
And
of that window of recovery, like you say, from an acute injury or
yeah.
whatever, then there's something else going on more than likely. But it's so difficult to see that, isn't it? Because like
It
you've
is.
got the x-rays,
And
the MRIs,
yeah.
the experts telling
And
you,
people are
no,
telling you, oh
you look
my gosh,
broken.
surgery, that like this is not going to work. I've done
Yeah.
everything I can for you. Sorry, you're gonna have to live with it. Um,
So
so
thank God
yeah,
you had an open mind enough to listen to that person that recommended this work to you. I
yes,
mean, what a
yeah.
blessing that you actually took that on board.
So I ended up going back to see her. I was fine, but I went back as a visit just to say thank you, to her.
Wicked. I love that.
Yeah, and so she said that, she's like, "You're the only one that's really taken this to heart." I
I
tell
love
people,
that.
she's like, "Oh, I'd hug you, but it's COVID." So I won't hug her. So yeah, I mean,
Great.
personality-wise, I definitely have always been a TMS personality now thinking about it,
Right.
perfectionism and a goodist and all those things. So I'm still,
Mm,
working on certain things along those lines and
Yeah, I
try not
think
to have
that's a
perfection.
continual job though, isn't it? I think that's something that you can just be improving about yourself, and there's always some kind of healing to go on emotionally. I
Oh
think
yeah. Yeah.
besides the pain stuff that goes away, like you might find now that because it's still so early days for you, the
Yes.
way that it went for me was like I focused on getting rid of my pain and making sure that I got out of that. But as a consequence of that work, the anxiety is also almost
Mhm.
completely gone. At times
Yeah.
it is completely gone. Sometimes it comes back as a flare and a symptom imperative. But for the most part, that is also completely gone. But also, like, you might continue to notice just the emotional changes that happen to you and the difference. You become a different person because you're so tapped into that,
Yeah.
not burying your emotions anymore and not kind of like just not dealing with shit head on and feeling
For sure.
braver and stuff like that. I mean, there's so many bonuses that come from this work. It's just crazy.
Even just as a mom, I mean, a mom of two
Yeah,
kids during a pandemic when I work in healthcare, it's just like,
for sure, for sure.
so that, even that though, I mean, I've noticed a change in myself, in regards to, the anxiety, more patience, which I lack, having,
Same.
being more, being more, receptive. And then, seeing certain behaviors in my kids that, I have, and I
Yeah, yeah.
now know how to help hopefully start that process of nurturing that to
Yeah.
not come to fruition, when they're 25 and dealing with all these issues,
Yeah,
letting
but
them
you can
start
impart all of
around.
this knowledge onto them now, like
Yeah.
Nicole posted the other day about,
Mm.
you heal yourself and you heal your children just
Yes. Yeah.
automatically
So,
because this ends with you.
yes.
This
Now
kind
it's
of
gonna
behavior
be
and
through. Yeah.
perfectionism and not feeling your emotions. And we're also discussing something in yoga class yesterday. And I'll have to dig out the resources that the lady was talking about. She was recommending a children's book about like worrying and feeling your
Oh,
feelings and stuff like that. And there's a couple of different recommendations on books for kids, about like how to draw your feelings and just stuff like that. That'd be quite cute to
I
maybe
would.
bring in and help your
I
kids with.
I tried that. I think we did some drawings, and then there's a kids yoga,
Oh,
that you can
cute.
find that is more like animation stuff. So
Love that.
yeah. So there's my anxiety, I've always had issues up and down. I've been on medicines, I've been not been on medicines,
Right.
I've been in and out of therapy, different things. It definitely has improved now knowing kind of where it comes from.
Uh-huh.
But I have noticed increased spikes, especially returning to work
Yes.
after maternity leave, being in with COVID patients, and just really,
Yeah.
in the thick of it, with that
Really
fear factor.
intense. Yeah.
Yeah. So I am doing Nicole's, um, uh, freedom from chronic or from anxiety and anxious life. There you go.
Yes.
Sorry about that. I'm working through that too. So I definitely have a few tools that I'm kind of
Love
using right
that.
now.
How are you finding it?
It's good. It's really good. I mean, it is helpful, and it does go along with the journal speak, going through that,
Right.
but a different direction. It's giving
Hmm.
me guidance, which I sometimes need, just to, here's a question, answer it, compared to just free for all, so
Yes.
that's helpful for me. With the Christmas holiday and things this week, it's been a little
Yeah,
challenging to
perfect
on
perfect
that.
timing to be working through a course like that, right?
Yeah, this season usually brings up some stress for a lot of people,
Yeah,
and
for
it,
sure.
then there's the loss, the feeling of loss, and the loss of a normalcy to have a holiday and see
Yeah.
family that you're not going to see. So,
Yeah, it's
we're going
almost as
through
a
that.
kind of form of grieving, isn't it? That you don't
I
have
think
what you
I
normally.
agree.
Yeah.
Yeah. So, hoping next year we be better with a lot of different
Well,
things.
we'll
So,
see.
yeah.
Maybe it'll be better. What
Yeah.
so we've covered the key steps you use for healing. Um what would you say would be your like the key points that you would impart on other people if they were in a situation like you were in the thick of it and really struggling, like other than obviously recommending resources and stuff like that? What kind of advice would you give people um, in a similar situation to you to kind of help them believe, or to just nuggets of wisdom you can think of that you might
Yeah.
tell
Like I
people?
said, really, like I said, what really impacted me was that you aren't broken, like you aren't damaged, like your
Hmm.
symptoms that you're having is your body screaming to you that you need to um, dig deep and see what's not going right in your body? Is it
Mhm.
something that you've a significant trauma that you've to deal with and overcome? Or Dr. Clark, I know, mentions kind of that repetitive negativity growing up, that
Yes.
maybe you needed this pattern to be broken.
Yes.
um, I honestly think that everyone has a component of TMS, I feel like, in their life. I think
100%.
that it 100%, some people
Yeah.
recognize it sooner than others. um, and so I think that was the biggest, nugget, I guess, of advice, is that no matter what doctors tell you, no matter who, your therapist tells you, or your, spouse or friend or family, you have the ability to be yourself, to heal yourself. Um,
Amazing.
yeah.
Even if you're working in a hospital where doctors are giving you advice and injections, and I mean that's so interesting.
Yeah.
I can't tell you how good that approach is to communicate to people through this story, that
Hmm.
even given the training that you have and being told, you know against everything you've ever believed, you still
Yeah.
kind of took it on board and recognized in this work that this is what was going on for you.
Yeah. Yep.
It's amazing.
Yeah, there's a lot of transition still, kind of with that mindset, in regards to whatever the problem is that I see someone for.
Yeah.
Um, but there are definite injuries or pain issues or things that, where I'm at in my position now, I don't have that ability or that power to influence too much right now, which is, I think, also a struggle, because I want to
Yeah.
be that person.
Yeah. Yeah.
But it's just not in my life yet. So that's a goal. A
Yeah,
goal.
and you're still so kind of early
I'm so
days
fresh.
as well.
Yeah. Yeah.
Really
So
fresh.
fresh. Hmm.
So fresh, but so knowledgeable already, even considering you've only been really doing this for a couple of months.
Yeah.
And that you're continuing to do the work, even though, you're kind of through the thick of that main sort of symptoms that you had. Um, but like I said, like I think this sort of work is just a tool really that you can carry on throughout your whole life.
Hmm.
And it can just help you offload, if anything, even if you don't experience symptoms. Just the offloading that you can do for the emotional release and your emotional pain and emotional world is just such a gift. Like,
Yeah.
there's,
Yeah.
you might pull back a little bit from that from time to time as you feel better, but it's always there. And I think that is such a massive gift. You don't have to necessarily go to talk therapy or anything else really. You've got your own back, and you
Mhm.
can have such dramatic, I mean, it's from your
Yeah.
story, this is just amazing that you've had such a dramatic effect just by using this work for such a short amount of time. It's amazing.
Yeah. Thank you. Yeah. It's been quite a in the last 6 months, I guess, in regards
Quite
to.
intense.
Hmm. Yeah. Yep. There. What was I gonna say? Oh, Nicole had mentioned the other day about, I forgot what podcast it was, but she had mentioned, like, sometimes she feels this pain and she knows it's this emotion that's kind of sitting.
Right. Yeah, yeah. You do. You get so tuned in. Like
Yeah.
I mentioned something on the group the other day, well, a few weeks ago, that I even sometimes I know something's coming on because I can taste this flavor in my mouth.
Oh, really?
And some
That's
people are
interesting.
saying like, yeah, that's a taste of adrenaline, or that's like an anxiety metallic taste, whatever. But it's not. I don't feel anxious. I don't feel pain. I don't feel. It's literally just like, hmm. I feel a flare coming on, you know, and sometimes it will happen. Most of the time, I can address it in my like emotional
Yeah.
thoughts, whatever, and it doesn't happen. Or if it does, I can pull myself out of it pretty quickly. So I think even if and this is quite interesting as well, because when I first went on Nicole's podcast the first time, I was only 20 days pain free at that point.
Okay. I
So
remember listening to
really,
that, though, the first one. Yeah.
really early on as well, just kind of like you, although it took me longer to get to the point that you did, but it was really early on in my healing, so to speak. But you might find still that you get peaks and troughs and stuff. Like, this journey isn't
Sure.
necessarily always a straight
Not a straight
line.
line.
Yeah,
No.
but you now know that whatever comes up for you. And it sounds like you don't really have, considering how much stuff you've had, you don't really have like health anxiety about certain things that come up
Not
with you.
anymore. I think I definitely did when I would get a pain flare. and I've had some falls. Like I actually broke my wrist with the fall.
Right.
Different. I fell on my back. Different things. I definitely had some anxiety with those, thinking, "Oh my gosh, this is it. Like I'm not
Yeah.
gonna be able to be where I was." I've made
Yeah.
stride, and then I get injured, and then so that has come up in the past, especially after that fall. I really messed up my pelvis at that point.
Right.
I fell on the ice carrying my daughter, so
Ugh.
um, that was pretty rough. But then I was able to recover from that. But there's been times where my adjustments weren't holding, and then I'm like, oh my gosh, I have to get this. I have to get this. I'm not. I
Hmm.
need to. You're good. I need to be right
Can
here. I
hear
need,
her.
to,
Sorry about that.
full blown. Uh, yeah. So the health anxiety is not too bad now. I guess because I can kind of see more of that
Yeah.
medical side of it.
Yeah,
Uh,
and I think you
so
can kind of also get over whatever happens to you much quicker, even if you do have a physical injury, or you don't get stuck in that fear pain cycle no matter what happens to you. If you do have a fall or you have something going on, you can
yeah,
kind of like recover from regular stuff quicker with this kind of work as well, I think.
yeah, I struggle, and maybe, I mean, definitely you offer some insight. Definitely still dealing with a lot of like headaches, muscle tension in my neck, back of my head, my jaw, face, all those things.
Okay, that's
And I know
interesting.
it's stress with just the situations that we're in right now.
Hmm.
Um, and I know that certain like physical modalities, Dr. Sarner always said that if you do them, sometimes they can,
Make it worse.
reinforce the idea that something's wrong, right?
Agreed. Yeah.
But then it comes to that point where you're like, well, I'm, suffering
What
here.
do I
What should
do?
I do?
Yeah. Yeah.
And so I still struggle with that. And I haven't seen a chiropractor since I've learned about TMS. So that's been a few months already, which is good for me because usually I would go like every week or every other
Yeah,
week.
so did I. I found
And
that I
then,
had to give up all of that kind of stuff to
yeah,
reinforce the right message to my brain. But I still,
you're
from
okay. Yeah.
time to time, I do still use either like my little massage machine, or I will go for a massage if
Yeah.
I'm feeling like it's just gone, oh, I'm really
Yeah.
tensing up, and then it just helps me release. But honestly, the thing that I do most of all now is breath work,
Yeah.
and or really gentle, like the restorative style yoga that I teach
Yeah.
regularly, which just really influences that parasympathetic nervous system directly and quite quickly, can pull you out of that kind of really
Yeah.
solid sort of state, and really soften your mind to soften your body. And that's been really key for me. So maybe
Yeah.
there's some space in your day where you could add a little bit of
So
breath
I've been
work, or add a little
trying
bit of
more.
relaxation.
The last time I had a true anxiety attack, which was recent. It took me a while to recover, but what I did is I put my headphones in and just listen to some meditations and try to just kind of reset, nap,
Yeah.
if I could.
Yeah.
I still do some trigger point release like on myself, and that's the only
Hmm.
thing that I think I try not to do as much. But it's sometimes like the migraines, the headaches are just so bad that I know where to push
Yeah,
into relief.
you're trying to bring relief to
Function,
yourself. I think that's totally normal. Yeah,
function as a human and a mom.
exactly. I mean, you're just doing what you can to try and feel better. I think that's fine. I think just over time as well, you kind of learn that as long as you're treating your body with love, and you're treating yourself from a place of love, rather than a place of, oh shit, I need to fix
Trying
myself.
to
This is
fix
too
yourself.
bad. I can't pick up my child. I need to go to pick up the school run, whatever that is.
Oh, me. Yeah, it was me a couple years ago, just petrified of picking up things or telling myself, "Oh, I can't do that. That's gonna bother me. I'm gonna be laid up for weeks if I do that," or
Yeah,
ABC, or I can't run, I can't exercise, and I
yeah.
can't repetitively wash anything, or so
I mean,
those
it
are
just
things that
takes
need to
time
stop.
as well. Like, yeah, it's still very early days for you, so it still
Yeah,
just might take some time for everything else to settle down, for you to kind of phase out those modalities and phase out the trigger point and stuff like that. But if it's working for you now, and it's making you feel, even if it's just momentarily better, then there's no, you can't say, well, that's all wrong. You're doing that all wrong. You need to stop all
how
of that.
dare
Like, who am I to say any of that? I'm no friggin' expert at the end of the day, but that's what worked for me.
yeah,
And just finding a practice as well that you love, that you can carry on doing ongoing as well, is really cool. So it's not always just used as a fixing thing. It's
yeah,
something that you actually enjoy, And that might be even like something exercisey or music, whatever that is, um, that brings you to that really calm place, but you like to do, hello, that you like to do on a regular basis, that you can just, it just becomes your day to day, then it's not something that you see as a fixing practice,
Yeah, it's not going to heal me, the physical
Yeah,
stuff is not going to
but it has
heal
the
me.
right kind of effect.
Yeah, yeah. That's definitely, again, with what I do, is that still that struggle, because it's, I'm still doing that with
Yeah,
patients. I'm
yeah,
still
yeah, yeah.
prescribing medicines. I'm still, so I struggle with that.
Yeah, and it's kind
Currently.
of a mixed message as well going into your mind, especially with your job, that you're dealing with people with physical issues and you're kind of prescribing and helping in one way, but then also dealing with your own body in a different way. It must be quite a weird conflict going on in your mind.
It is, and every day is a little different. Obviously with the current state of the pandemic, it's, I've been able to focus more on that. So that obviously is not going to be changed. I don't think
Yeah,
that's real.
sure. Yeah, yeah.
Um, but in regards to the other issues, yeah, I definitely am working through that. Um,
Hmm.
so I don't have answers for that yet.
No, doesn't matter. You don't have to have answers.
So
This is all just a journey, isn't it? It's like
yeah,
there's ups and downs, and there's new stuff to learn at every phase, and the stuff that you're reading now, the more textbooky stuff, is going to be, really beneficial to yourself. And let's just see where it goes. I'm excited to see where this takes you, and where,
yeah,
where
me too.
you might be able to, well, you already are now, especially doing this is going to feed out to other people, and you're going to help other people just by sharing your story. So
Yeah,
that grassroots kind of web is just going to exponentially grow from here.
I'm
So
hoping for
yeah, of
sure to
course, for sure it will.
get out to other people and
Yeah. And the amount of
spread the
people you
word.
see, the amount of people you see on a day-to-day basis, the more you learn, the more you can share that, even if it's just planting the seed in someone's mind that there might be an alternative to whatever it is that they've been diagnosed with, or whatever it is they've
Yeah,
been kind of scheduled for surgeries and all that kind of stuff. Like, just mentioning these things to people, and people look up to physicians so much and put so much power in their hands for this kind of message of like fixing and healing and stuff. Like, for you
mhm.
to be able to impart that kind of advice from a different perspective is, like godly, really, isn't it? It's amazing.
That's my hope. So I really haven't had this sense of motivation or drive, I guess, for a long time.
Yeah,
Because I was always trying to
yeah,
focus more on, you know, all of my ailments or all of my issues, and
sure.
the fact that I realized, that I'm not a burden. I don't have to, you know, pay all these copays and go to
Yeah,
all these specialists because this or that's bothering me more this time around. And,
right.
so I'm working through some of that, history, and
Yeah,
moving forward and just trying to be, a better mom and wife and
I'm
person.
sure you're doing
So
amazing. Like, don't beat
that's
yourself
tough.
up about it. And I know that
Well,
this
that's
is,
just the way we are though, right?
yeah,
That's
but that
part
will
of my,
change. That will change, I
it
promise
will
you.
change, but
And
quick.
that was something that was like one of the last things for me, through this work, was the self-compassion side.
Yeah, yeah, I'm
Accepting
working on that one
yourself.
for sure.
Yeah,
Yeah,
it will just naturally happen. It's like a side effect.
good.
I was actually thinking of releasing, I've said this before a few times, I've got loads of cat hair up my nose now. Releasing like an article about the side effects of journal speak, like
Yeah,
it sounds really drastic, like, oh shit, what's that going to tell me? But just the amount of different things that it changes in you. One of the biggest things for me that I never even had any idea was an issue for me
yeah.
was self-compassion,
Until it was better. Yeah,
just self-acceptance. Maybe never I'll get to the day where it's self-love, but it's wholeheartedly self-acceptance now.
yeah,
And with all my quirks and weirdness and all my flaws and all that shit, like, whatever, everybody has it, so what? Like,
yeah.
you're doing your best, and what you're doing is enough, and that's all that matters. Like, I'm sure you're a great mom and a great wife, and
Thank you.
don't beat yourself up about things that you're not sure whether you are or not. Like, I'm sure you
Yeah,
are.
the control situation, I mean, just part of I mean, I'm saying our, meaning like per TMS personalities, but
Yeah,
not to talk for you, but I
yeah,
mean, I was always, I mean, I still am someone that I want certain control things, over so that I can manage what
sure.
that outlook looks like. And,
Yeah,
um, I can, what's like foresee and kind of list all of the things that
yeah,
scenarios that could happen or wouldn't happen, and A, B, and then this would happen.
yeah.
And I'd react like this.
I
So
totally
I'm
get
working on
that.
that too. I think,
But that's That's all just part of the basic underlying like principle of all TMS work is trying
Yeah.
to make your sorry, trying to make trying to make yourself Kuna,
Danger.
trying to make yourself feel safe.
Safe. Yeah. Yeah.
Like you scan the horizon of your life and make plans and plan B and plan C and plan D. And well, you need to tell me how this is going to go because I need to feel safe. You're going to tell me how this is going to go because I need to know that that's going to be all right.
Yeah.
And that just settles down. Everything will settle down. I mean, I'm not promising miracles for you, but I think this is something that came quite late on for me and is still building now. I'm still noticing differences from this work even a year on. It's like just over a year now since I kind of started with Journal Speak. So it continues to surprise you and change your life. And then also when you start to impart all this stuff on other people that I'm now noticing through the yoga work and stuff that I'm doing, that you will just get so much healing for yourself by helping other people as well, which is yet for you. You won't necessarily have you won't necessarily have felt any of that yet, but that is something that is equally as healing when you're helping everyone else and you're getting that kind of vibe back from them that is helping them.
Yeah.
So thank you so much for taking the time to tell us your story. I find that really fascinating, and I really hope that you find your own little niche way to work this into your work, whether that is still in a physician's office or in some hybrid that you create for yourself, whatever that is. I wish you all of the success and best with your rest of your journey. I'm actually excited to hear how this kind of goes as well in your continual like anxiety course and stuff like that. So please keep in touch, and I look
Well,
forward
thank
to
you
hearing
for the
from you.
opportunity and all the work that you do. I've definitely
Thank
been
you.
following and continue to. So I appreciate
Yeah,
everything. Yeah.
you're welcome. Thank you so much. So I'm gonna just let you out of the room and then I'll just close. So thank you so much,
All
Erika.
right. You're
Take
welcome.
care.
Have a good holiday.
And you, darling. Happy holidays. Bye. Wow, that was a great story from Erika, a physician's assistant. Like, wow, she's about to blow her career completely into stratospheric proportions. That's so exciting for her to change all of that learning into something so completely different with her own experience as the basis for that. Sorry about the weird flashing screen that's been going on. I don't know whether that's going to be in the recording, but it's been kind of a bit flashy for me. And sorry about the cat jumping up as well. Covered my face in cat hair. Anyway, this is as casual as it gets. Like, this is real life. Thank you so much for watching. If you want to get involved in this series, you can submit your story. If you're still healing from TMS or you are, just starting on your journey, but you've had light bulb moments or breakthroughs or milestones that you'd like to share that you think would be beneficial for people to learn about, get in touch with me there's a little form on my website. If you go to mytmsjourney.com/stories, there's a section on there where you can submit your story and share that with me. That comes directly to me. And yeah, we can look through all the submissions that we get and then talk to more people and share more stories. And I will stop talking now because you're probably sick of my voice. When this will air is around Christmas time, so I will wish you happy holidays, happy new year. If you don't celebrate, then just happy every day to you, and I will catch you on the next one. Thank you for watching.